the next 15 minutes to introduce who we are, provide a brief introduction to core resources, and give a quick whistle-stop tour of Medicines Complete. If you have any questions as we move through the presentation, please use the chat facility and we will attempt to answer as many questions as possible at the end. The Royal Pharmaceutical Society has been serving the pharmaceutical profession for over 180 years. In 1841, the Pharmaceutical Society of Great Britain was founded to represent the profession and protect the interests of chemists and druggists. The society was formed because the profession needed a body to campaign on their behalf and to protect their interests. Since then, a royal charter has been achieved, the British National Formulary was born, and in 2004, Medicines Complete was launched. And this year, we are excited to celebrate the 180th anniversary of the Royal Pharmaceutical Society. Pharmaceutical Press is the Royal Pharmaceutical Society's knowledge business. It's trusted worldwide for providing accessible clinical advice to improve patient safety. We support healthcare professionals quickly and confidently make the most informed decisions on the safe and effective use of medicines. Our respected resources are referred to daily by healthcare professionals worldwide, and this is across healthcare, academic, and research settings, and it's also relied on by many commercial organisations to operate their business. National agreements with parts of the National Health Service in the UK mean that much of the NHS has unrestricted access to our resources through our online platform, Medicines Complete. So we launched Medicines Complete to make it easy for healthcare professionals to get quick and easy access to our trusted resources at the point of care. And it's also with the added benefit that our knowledge and guidance is regularly updated. We support healthcare professionals to effectively manage different complex patient groups. And this is from neonates through to those are at end of life or those in critical care. Medicines Complete helps you to make quick and confident decisions to minimize medication errors. We are here to help improve patient care. Since the launch of Medicines Complete, we have regularly added new core and specialist resources, as well as point of care checkers and calculators to support healthcare professionals improve patient care effectively and efficiently. Trusted evidence-based resources include the British National Formulary, Stockley's Drug Interactions, Martindale, the Complete Drug Reference, Palliative Care Formulary, and more specialist resources, including newly launched critical illness and Clarity's diagnosis and treatment guidance. Essential resources are continually updated to ensure guidance is based on the latest evidence-based literature and reflects new medications and clinical practice. Our skilled editorial team of clinical writers includes pharmacists and science graduates who triage new information, assess evidence, and review changes made by other clinical writers before publication. Certain content is further assessed by external experts, committee, and peer review. This ensures clear, concise, and actionable guidance. From diagnosis of common conditions to prescribing, dispensing, and administering medicines, Medicines Complete provides quick and easy access to expert evidence-based knowledge. We recommend these trusted core and specialist resources to support your teams improve patient care. Now I'm going to do a quick tour to show the content and key features of Medicines Complete. Hopefully you can now see the Medicines Complete screen. So I'm going to start off by showing you the BNF. The BNF is the unrivaled guidance on prescribing, dispensing, and administering medicines. It's organised by drug and treatment summary. Let's use the drug haloperidol as my first example. I want to point out that there are dosage cards at the top of the page, and you can switch between the BNF for children, and the Martindale. as you can see here. And this will give you those quick decisions. Okay, so let's have a look at the drug monograph. Within a BNF monograph, you'll find various subsections, including indications and dose for adults, and where applicable, the elderly. It also includes unlicensed use of medicines when the clinical need cannot be met by licensed medicines. Where possible, we've included specialised information on pregnancy, breastfeeding, hepatic and renal impairment. And throughout the monograph, there will be various hyperlinks. So as you can see as the blue underlined text here, this will take you to additional relevant information within the BNF. Another useful tool is you can search by drugs within a class to compare with one another. Okay, now an example of a treatment summary is if we use psychosis and related disorders. As part of NICE accreditation recommendations, BNF content is evidence graded to reflect the strength of the evidence base behind them. And this increases transparency to support healthcare professionals with clinical decision making. Now, another popular resource is Martindale, the Complete Drug Reference. So the Martindale helps provide hospital pharmacists with evidence-based global guidance. So I'm going to use propranolol as an example here. Okay. Now, the Martindale contains drug monographs with advice on indications, dose, and pharmacokinetics. But there is also a really useful section on preparations, and this contains information on available brands in over 40 different countries. A hospital or a community pharmacist could use this if a patient turned up with medication from a different country. And it's particularly beneficial if you work near an airport or in an area where there's lots of tourism and a patient turns up with a box or a brand. So you could search for the brand at the top, or you can also click through here. And there'll be information on the manufacturer as well. Okay. Now, there is also a comprehensive longer treatment summary, which is designed to advise on prescribing decisions. So if I use hepatitis B as an example. So this will give you a lot of fully referenced information, and it's based on national and international guidance. And if available, it will actually give comparisons too. So they also refer to evidence-based behind these documents with details of systematic reviews, meta-analyses, and so on. To use alongside the Martindale is the trusted Martindale ADR checker tool, which is exclusive on MedicinesComplete. It helps support decision-making and manage patients with adverse drug reactions. It's an essential tool with a very comprehensive and powerful search functionality, and it allows you to quickly search and compare drugs with ADRs with filters. So for example, if we use the example hepatitis again, so it will flag anything severe at the top. It's color coded in that sense. And you can also use the filter functionality if you want to filter between frequency, age, body system, or route. So you can also click through for more information on the ADR profiles, and this will tell you about the mechanism, prevention, and a more comprehensive management of the ADR. Another useful functionality is you can also use the checker to search by drug class, and this will allow you to compare for drugs within the same group. So if we use statins as an example, and you can have a look here, and you can also add in an ADR. So we could add in rash, and it might mean that you would choose to prescribe something else instead. Okay, I'm going to show you Stockley's next. Stockley's drug interactions is the most indispensable source of drug interaction information. It provides expertly authored advice on managing drug interactions and will quickly help you decide your best course of action. So if I use, for example, simvastatin And if I use itraconazole as well, see, they'll have a concise summary, and it will be, again, the severe reactions will be flagged as a red alert symbol. If you require more information, you can click through to the more in-depth Stockley's drug interactions, which is here. And this is a large monograph with more comprehensive information on the mechanism of action as well as management, and it will provide references too. So with Stockley's, you can also input an entire patient's medication list. So you can actually search for unlimited drugs at once. So I'll add in a few more to give you an example. So we'll use omeprazole and we'll use warfarin as well. And this will allow you to compare between, and it will bring up all the interactions and the most severe at the top. So it's worth noting that in 2018, we acquired the palliative care formulary and we relaunched it as an online resource. So it provides unrivaled and expert drug information for health professionals when caring for adult patients facing progressive, life-limiting diseases. But to finish this demonstration, I'd like to show you our two newest resources, which were launched in January. First of all, we have critical illness. Critical illness is an indispensable resource to guide the most effective treatment for adult patients in intensive care. At the onset of the pandemic, demand for intensive care beds escalated, and health professionals with limited specialism in critical care were mobilised. Publishing plans were refocused on the development of critical illness. It was accelerated to meet the urgent requirement for trusted drugs information. And expert teams across our organisation and specialists working in clinical practice collaborated to prioritise development. In just 4 weeks, an advanced version of critical illness, including 6 drug monographs specifically useful for COVID-19 patients, was made available. And response was overwhelmingly positive, and the critical care community rallied, resulting in 70 expert contributors coming forward to support the first full edition of critical illness. If I show you an example, we'll use clarithromycin. So the resource is written by a range of international experts working in clinical practice, and it follows the same format to the BNF. Most sources for prescribing advice currently available do not take account of the effects of acute illness and organ failures, and the dramatic and rapidly changing impact these have on drug pharmacokinetics and pharmacodynamics. We wish to support a new philosophy of dynamic prescribing, adjusting the doses to the circumstances affecting the individual patient. And now another recently launched resource is Clarity's Diagnosis and Treatment Guidance. This covers over 370 clinical topics for use in primary care. So clinical topics have been commissioned by the National Institute for Health and Care Excellence, otherwise known as NICE, and this is for use in the UK's NHS. It covers over 1,200 clinical presentations or patient scenarios, and this guidance helps healthcare professionals reach a diagnosis, prescribe safely, offer safe and effective treatment options or referral for specialist care, and also create local protocols and guidance. Let's have a look at the asthma monograph as an example. So it looks at background information on the condition and symptoms to look out for. It will discuss risk factors, prognosis, and complications. It will give recommendations for if diagnosing with a condition, and it will provide different scenarios. You can see, for example, here, if a patient's been newly diagnosed with asthma, or how to manage if a suspecting patient has COVID-19. There is a section on how to treat the condition and information on prescribing, but we would recommend that you use the BNF to look at information in more detail to consider different dosages, interactions, adverse drug reactions, and so on. So that's the end of the demonstration. I'd like to share my presentation again and show you a testimonial from a hospital pharmacist. Hopefully you can see that screen again. Every day, healthcare professionals in more than 130 countries turn to our resources. This customer in Australia subscribes to MedicinesComplete to provide their clinicians and consultants with unrestricted access to the Martindale, the complete drug reference. Senior pharmacist Mariana, who works in the medicines information department, uses the essential resource to help her with comprehensive responses for medicine inquiries. From the fundamental chemical structure of medicine to the practical listing of preparations and their international availability. Okay, well, thank you for listening. Please let me know now if you have any questions, or if you'd like to find out more about MedicinesComplete or to set up a free trial, please go to our website, or you can also copy the link on the screen.